Hi. The purpose of this video is to talk about your recent diagnosis of a pulmonary embolism, or a PE blood clot in your lungs. This PE blood clot causes a blockage in one or more of the blood vessels that supply blood to the lungs. You may have experienced, or may still be experiencing, shortness of breath or pain in the chest as a result of this blood clot. We understand that this new diagnosis can be stressful and frightening. You are not alone. Blood clots affect many people, in fact, nearly 1 million people in the United States each year. You've been asked to participate in this research study because, in addition to your new PE diagnosis, you have been noted to have one or more of the following common underlying medical conditions. These include high blood pressure, high cholesterol, diabetes or an elevated blood sugar level, and an elevated weight or obesity. These conditions are oftentimes grouped together and may be referred to as metabolic syndrome when occurring alongside each other. In this brief video, we hope to explain how better controlling these conditions may be beneficial in your overall recovery from your PE blood clot.
Metabolic syndrome, which again includes high blood pressure, high cholesterol, high blood sugar levels, and obesity, is becoming more and more common, affecting at least 1/3 of adults in the United States. Having a combination of these conditions increases your risk of several health problems, including heart disease. Unfortunately, these conditions are also thought to play a role in blood clots. Having one or more of these conditions may lead to increased inflammation in your body, causing your blood to be more likely to clot. What about in the case of someone like you, who has already been diagnosed with a blood clot? Well, having these other underlying conditions can make your recovery from a PE blood clot more difficult. They have been shown to carry with them a higher risk of going on to have another blood clot in the future, as well as being associated with having a lower quality of life after PE in some patients. So now knowing this information, what can we do about it to help prevent some of these unwanted complications? The standard treatment for most PE blood clots is anticoagulation, sometimes called blood thinners, although we prefer not to use this term as it is inaccurate. These medicines help keep the clot or clots in your lungs from getting bigger. They also help lower your risk of getting more clots in the future. Your doctors will talk to you more in depth about the plan for anticoagulation. In addition to treating the PE blood clot itself, it is also important to help control these conditions that make up metabolic syndrome. Again, these include things like high blood pressure, high cholesterol, elevated blood sugar levels, and obesity. The good news is that all of these conditions can be modified and treated. It will be important to follow up with a primary care doctor to make sure you are helping to control these conditions, which might include specific medications. However, in addition to medications, you may be able to further reduce your risk of complications through lifestyle changes, including weight loss, dietary changes, and exercise. We would like to spend the final couple of minutes talking to you a little bit more about the importance of exercise, specifically walking. Exercise, or physical activity, has many health benefits. In general, studies have shown that people who exercise regularly live longer. Exercise can help decrease blood pressure, improve control of blood sugar and fats, and promote weight loss. And it may reduce the chance of having other severe problems such as stroke, heart attack, and even cancer. Exercise has also been shown to help reduce stress and anxiety. Related more specifically to blood clots, exercise can decrease the amount of inflammation in the body, prevent blood from pooling or sitting still for too long, and reduce the likelihood of clotting. We believe that engaging in regular walking-based exercise will be beneficial to you given your recent diagnosis of a PE blood clot, and may help prevent some of the unwanted complications that can develop after suffering from a blood clot. A simple way to start exercising is to walk, and this is what we will be recommending for you to do. The Centers for Disease Control, or CDC, recommends that people engage in moderate intensity exercise for 150 minutes per week. Said a different way, this would equal exercising at least 30 minutes a day on 5 or more days of the week. If you can't exercise for 30 minutes straight, you can try to exercise for 10 minutes at a time, 3 or 4 times a day. There are many ways that you can be more active and try to incorporate walking into your already busy life. This might be parking in a parking space that is farther away from the door, or taking a longer route when you walk from one place to another. If you have access to a treadmill, either at home or at a gym, this could also be used for walking. Again, the recommendation is for you to try to walk at a brisk pace or engage in other moderate intensity exercise, which could include activities like bicycling at a casual pace, dancing, golfing, or performing house or yard work for 150 minutes per week, or about 30 minutes a day, on 5 or more days of the week.
To conclude, we understand that a new diagnosis of a PE blood clot may feel overwhelming, and you may feel that there is a lot of information to take in. The main take-home point from this video is that controlling your underlying risk factors through diet, daily walking, and at times the addition of specific medications may be beneficial to your overall recovery and may help prevent some of the unwanted complications that can develop after suffering from a blood clot. Thank you.